And I'm encouraging everybody, especially our health workers. I think COVID came in and made it and made people aware that health workers are extremely important. At some point, and I think that has not ended. That time people thought that lawyers were the best, but during this COVID pandemic, you remember, everybody was paralyzed, and the only sector that was moving, and the only people who are working were health workers. And therefore, I think we need to take advantage of that position. And therefore, even as we start the vaccine, let's ensure that we encourage all our health workers to take the vaccine, so that you have courage, you have the confidence as we are helping our other COVID patients. I know for this time, as we target health workers, we've been given 3,000 doses of the vaccine. We already have about 1,250 of our health workers, county health workers. I'll encourage the director and the team to also identify the other health workers, especially the health workers who are working in faith-based organizations, our health workers who are working in the private sector, so that we have a strong team that that's handling the COVID issue. I know there's so much speculation about this vaccine, and I think Dr. has assured us that we are safe with it. We've also talked to many people, and I think it is our time. And I think I was talking to Dr. Misoi there and a few health workers. It is us to demonstrate, and it looks like advocacy to ensure that people accept this vaccine, and those speculations out there, we should overcome them through us taking it. I'm ready. For me, I'm ready to take it. Among the first people in the county, the governor was very clear. He also wanted to come in, but unfortunately, there's a meeting of the Council of Governors that he had to attend. And therefore, as we are here, we'll take it. I know Fred, the Chief of Staff, is willing. I mean, like he heads the office of the Governor, the executive, and therefore he represents that office. And so we want to encourage all our health workers to ensure that they take up this vaccine. It will give us the courage and the confidence to handle this pandemic much better. In terms of the rollout, for now, the government has focused on identified this referral, but our target is to move out and have another station in Kilgoris, where we're also looking at the Transmara side, and slowly move into our small health facilities. So it will take time, and I think that Claire talked about the different phases. For now, the target is the health workers. After this, we'll be targeting teachers, we'll be targeting the security teams and all that. But for now, let's take advantage as a team. As we've been told, it's free. The government has partnered with other donors to ensure that we get this vaccine for free. So I think it's a good thing, and we really have to encourage our colleagues. I imagine that we are among the most senior people in this county at this level, and therefore we should encourage other people just to take advantage of this forum that we have today. I think it is very important for us not to forget where we are coming from. And you all remember that on March 2020, at the time we got our first COVID case. For Narok County, we got our first case in June. And we know how devastating it was to get our first case. And therefore, I think it's good for us to appreciate the journey that we are in and how we've been able to, manage our COVID cases for all those. For that time. As we get this vaccine, which I think it's a very positive thing, especially now that we are targeting our health workers. It is very important that we don't forget the other strategies of handling COVID: wearing our masks, washing our hands, sanitizing, keeping that social distance. So it's very important that even as we go into this taking this vaccine, it is very important that we don't forget those other measures that the health protocols